Hello, this is Ariana Stevens presenting a presentation on meningitis for medical terminology. What is meningitis? Meningitis is a disease of the nervous system that takes place in the meninges, where the connective tissue becomes inflamed due to infection. An injury to the brain or spinal cord, as well as cancer or a reaction to certain drugs or other inflammatory disorders, can also be the cause of the disease. Where does meningitis take place? Meningitis is considered a disease of the nervous system as it takes place around the brain and spinal cord. Sometimes the bacteria can make its way through the spinal cord and up to the brain. Today we are going to focus on different forms of meningitis, bacterial being the most fatal, viral being the most common, fungal, parasitic being the most rare, and non-infectious. Meningitis, when it is broken down into its medical terminology, is the inflammation of the meninges. The meninges are connective tissue that surround and cushion the brain and spinal cord. They are comprised of several different layers. Here are the first three layers of the meninges. First being the dura mater, which is the first layer of the meninges, also the most external layer and the toughest. Think of it as the epidermis on the skin. Next up is the subdural space, which is the gap between the dura mater and the arachnoid. The arachnoid, much like its namesake, are thin spider-like filaments that are not as strong as external layers and turn into more of inner layers as you go in. The pia mater is the softest layer of the meninges, actually the one that directly touches the surface of the brain and spinal cord. They are web-like structures. In between them are subarachnoid space, which is the gap between the pia mater and the arachnoid layer that we explained before. Cerebrofluid flows within the subarachnoid space and is also cushions and absorbs damage from the spinal cord and brain from outside forces. Now let's focus on the different forms of meningitis, the first and most common being viral meningitis. This is when the virus enters through the mouth and is considered an enterovirus, entero being the combining form for small intestine. It has traveled through saliva and bodily fluids and even fecal matter. It enters the body and travels up the spinal cord to reproduce. It is also the least severe to treat, usually can be prescribed by a doctor for just bed rest and missing a few days of work or school. Next up is the bacterial meningitis, which also happens to be the most fatal and the highest mortality rate. Death can happen within just hours of the diagnosis. Bacteria enter the body and usually start in the upper respiratory tract. From there, it enters the bloodstream and goes to the brain. It can cause brain damage, death, or permanent disability. Vaccinations are available for meningococcal meningitis, and it's usually treated by antibiotics depending on the severity. Next, we have fungal meningitis, which is usually transferred through a fungus. It makes its way into the spinal cord. It is more dangerous to those with weaker immune systems who are more prone to being sick. It can be found in the soil and in animal droppings that are inhaled and taken into the body. It can also be treated with antifungal medication and sometimes steroids, depending on the case. Parasitic meningitis is the most rare and usually has a high fatality rate due to the fact that it's not observed as much as the other forms of meningitis. Bacteria known as Naegleria fowler is found in warm freshwater and enters the body through the nasal passage. From there, it causes an infection that can reach all the way to the brain and then cause deterioration. It does not have a specific treatment and is done on a case-to-case basis. It can also be found from ingesting undercooked fish and eggs with the parasites already inside. The last form of meningitis that we will discuss today is non-infectious meningitis. And contrary to its predecessors, which can spread, this one is more situational and changes based on the source. A reaction to medication can trigger the inflammation of meninges, as well as blunt trauma or any kind of damage to the spinal cord or brain. Certain types of diseases, like lupus and cancer, and even cancerous cells, can also be directly related to breakouts of non-infectious meningitis. Symptoms of meningitis can vary from case to case. It can start as simple as running a fever or having a headache, having nausea, sensitivity to light, the stiffening of the neck, loss of focus, and lethargy. In most extreme cases, seizures take place. When it comes to the diagnosis, sometimes it can be erased against time depending on the form of meningitis. Usually, a sample of the spinal fluid is extracted with a lumbar puncture or a spinal tap. This procedure involves a patient on their side as a needle is inserted into their spinal cord in between the vertebrae in order to collect cerebral spinal fluid for testing. When these tests are sent back to the lab, they technically look for excessive white blood cell counts as well as the bacteria of the infection. Sometimes if it's suggested that there might be meningitis in a brain, a computerized tomography scan can be used to check for brain swelling or other abnormalities. Treatment is based off the patient and their circumstances. Viral, fungal, and parasitic meningitis can be treated with steroids or antifungal medications, and sometimes these can be administered by an IV drip. Bacterial infections, as well as non-infectious meningitis, can be treated with steroids. If there is an infection in the upper respiratory system, an oxygen mask may be used to ease the patient's breathing. Meningococcal meningitis is a vaccination for the most fatal form of meningitis, which can be administered to teenagers from ages 11 to 12, followed by another round of booster shots at 16. In conclusion, meningitis comes in many different forms but is still a disease that must be kept up with. It can range from a viral infection that can just be treated with bed rest, or go into a full-blown bacterial infection that could lead to death in just a few hours. The central nervous system is comprised of the spinal cord and the brain. Because of this, meningitis can lead right up the spinal cord into the brain. Most meningitis bacteria can be detected with a lumbar puncture to test the cerebral fluid for an excessive white blood cell count. Meningitis can also be found in many different forms. The basis of this disease, again, is the inflammation of the meninges, which are the connective tissues surrounding the spinal cord and brain.